All right, today we're diving into Chapter 8 of a short textbook of psychiatry to tackle a really fascinating group of conditions, the neurotic, stress-related, and somatoform disorders. This is where the line between our minds and our bodies gets incredibly blurry.
So, let's kick things off with a question I think we've all probably wondered about at some point. What's the actual difference between just feeling stressed out, from daily life, and having a clinical stress disorder? That's the core question we're going to explore, using the textbook as our map.
First up, let's talk about anxiety. It's a feeling every single one of us knows. But there's a tipping point, a line, where it goes from being a totally normal, even helpful human emotion to a real clinical problem. So, where is that line?
Okay, so the book breaks down anxiety into two useful ideas. First, you've got trait anxiety. You can think of this as someone's baseline, their natural tendency to be anxious. It's kind of like a personality setting. Then there's state anxiety, which is all about a specific moment, like the anxiety you feel right before you have to give a speech. Knowing the difference is super important for what comes next.
And here's where we see that critical divide. Normal anxiety? That's your body's alarm system doing its job perfectly. You see a bear, you feel anxious, you run. It's a good thing. But pathological anxiety is when that alarm system goes haywire. It's either ringing constantly for no reason, or it's so deafeningly loud that you just can't function. That last part, impairing your daily life, that's the real key.
This quote from the text really nails down the clinical definition. See, a disorder isn't just feeling bad. It's about causing profound personal distress. It's about a measurable inability to do things, what the book calls objective disability. Or, and this is a big one, a real loss of freedom, where your entire world starts to shrink because the condition is boxing you in.
So with that in mind, let's look at the anxiety spectrum, because this isn't a one-size-fits-all thing. Pathological anxiety can show up in a whole bunch of different ways. Now take a look at this table, which comes straight from our source. It splits the symptoms into two columns, physical and psychological. And this is so important, because it shows that anxiety is not just a feeling. It's a full-body experience.
Let's just highlight a few of the really common ones here. You've got palpitations, that feeling of your heart just racing or pounding in your chest, the sweating, the inability to focus on anything, that constant irritability, and that one at the bottom, that terrifying feeling of impending doom, that can be one of the scariest parts of it all. These are powerful physical and mental events.
Now, one of the specific diagnoses is something called generalized anxiety disorder, or GAD. A good way to think about GAD is as the marathon runner of anxiety. It isn't about short, intense bursts of panic. It's this chronic, excessive, free-floating worry about all sorts of things that just goes on and on for at least 6 months.
And you can contrast that with panic disorder. This is the complete opposite of a marathon. It's a lightning strike. It's not that constant hum of worry. It's a sudden, overwhelming, tidal wave of terror that seems to hit with absolutely no warning. The book uses the phrase out of the blue, and that really captures it, that feeling of being ambushed by your own body.
So, we've seen how anxiety has these really powerful physical symptoms. But what happens when the mind takes it a step further? What if the psychological distress doesn't just cause physical feelings, but actually becomes a physical symptom? This brings us to one of the most fascinating topics in this whole chapter, the mind-body connection. And this is where we enter the world of somatoform disorders. Soma is Greek for body, and that's the whole point. A person is having very real physical symptoms. Real pain, real numbness, real weakness. But after all the tests, all the scans, doctors just can't find any physical disease that explains it.
A classic example of this is conversion disorder. Way back when, this was often called hysteria. Today, we understand it as a process where the brain literally converts an unbearable psychological conflict into a physical problem. So you might see someone suddenly become unable to walk or unable to see, but there's no neurological reason for it.
This diagram from the textbook is an attempt to map out how that happens. Now, I know it looks a little complex, but it's really telling a story about how the mind tries to protect itself from overwhelming stress. Let's break it down, step by step. Okay, it basically boils down to this 3-step process. First, you've got some deep unconscious conflict that's creating a ton of anxiety. Second, the mind uses a defense mechanism to turn that emotional pain into a physical symptom. And third, and this is the wild part, that physical symptom actually provides some relief from the original anxiety. The textbook calls this the primary gain. A paralyzed arm is awful, of course, but for the unconscious mind, it might feel less threatening than confronting the actual conflict.
All right, let's pivot now
and look at disorders that are a direct result of some overwhelming external event. This is what happens when stress crosses the line into trauma.
So, an acute stress reaction is what happens in the immediate aftermath of a disaster. Think about the hours or maybe the first few days after a major accident. The person might seem dazed, confused, maybe emotionally numb. According to the text, the reaction is super intense, but it usually starts to fade pretty quickly once they're in a safe place.
PTSD, though, is a very different animal. It's often a delayed and a much longer-lasting response. The absolute hallmark of PTSD is that the person can't leave the trauma in the past. They are forced to re-experience it over and over through flashbacks and nightmares. And we're not just talking about a bad memory. It's a full sensory reliving of the event that makes it impossible to feel safe, even now.
And this timeline here really shows how insidious PTSD can be. The catastrophic event happens, but then there's often this latency period. For weeks, maybe even months, the person might seem totally fine. And then it starts. The flashbacks, the constant avoidance of anything that reminds them of the event, and being in this state of high alert all the time, which we call hyperarousal. It's a disorder that can hide before it pounces.
So, we've covered anxiety, we've covered somatoform disorders, we've covered trauma. If you take one thing away from all of this, what should it be? It's this. This is the core message. None of these conditions are a choice. They are not a sign of weakness. They are not something you can just get over. Whether it's a panic attack or PTSD, these are real, medically classifiable health conditions. The pain is real, and it deserves real understanding and care.
And just to hammer home how common this stuff is, the textbook points out that in any given year, up to 8% of the general population might experience generalized anxiety disorder. That makes it the single most common psychiatric disorder out there. This is not some rare, fringe problem. It's a fundamental part of the human experience.
Which really leaves us with one last big thought to chew on. We've just seen how a psychological conflict can literally cause paralysis, and how emotional stress can create very real, very physical symptoms. So, if our minds and our bodies are this deeply connected, how should that change our entire approach to health and medicine? Something to think about.